I'm Karen Tomke. Welcome to the Centennial Family Health Center in Ordway, Colorado.
You know, we are just very fortunate to be able to have a clinic in a small county like this, and with the resources that we have here, you know, in the treatment room and the little, you know, ER room, and have an x-ray here.
You know, we stabilize if they have a heart attack, we do orthopedics, we just do sutures, we do laceration removals, we do cancer biopsies for skins, because people just can't travel. So we have that expertise, and women's health care is a big specialty with me. So a lot of women who can't get to a gynecologist, it's pretty hard, would do their GYN care. We also offer family planning. I grew up in Crowley County, and back in the heydays when there was about 70,000 acres of irrigation here with cantaloupes and watermelons and tomatoes and canning factories, and real go for the county. All kind of changed when I was a sophomore in high school. The first people to come in was a kind of a company that bought it up, and they bought the farms and they convinced people to sell their water and their ground for something like $350 an acre. And they thought it was a lot of money, but they scared people. There's just a handful of farmers left that are farming, and my family's some of them that kept the water. And so that really hurt us. A lot of families left. They had their kids or my age. They left. There was nothing for them to do. And so we have struggled ever since with, you know, that was like a pot of gold. And now the lawns in Aurora, they have a lot of our Colorado Canal and Colorado Springs, you know, and Pueblo West, you know, so that's where, you know, so that's that whole water law issue in the state. I grew up in Crowley County, and I went to school here, graduated in '71, that ages me. Went off, I always wanted to be a nurse, and I went off to University of Northern Colorado and got my bachelor's degree in nursing. The nurse practitioner role was just starting back then, and I was spending some time in Fort Collins, and Public Health Nurse had some nurse practitioners, and they were doing women's health care, and it was like, wow, this is just so cool. Because for women, we've always had men give our health care, and it was a little hard to get to pay gynecologists to have money, so there were a lot of women who didn't have health care, and that's controlling their fertility and just a lot of problems that they had and mental health issues. So I got exposed to that, and I thought, yes, I want to do that. She was able to get a family doc here for a few years, and then he went off to the city. So she was like going, oh, I need somebody to help. She was just getting worked to death. She was on staff at Lahana Hospital. And so she was just going back and forth. And so someone said, one of my patients says, oh, you should contact Karen Tomke. She grew up here. Maybe she wants to come back. So I got a letter from Dr. Berg. It's Mary Jean Berg. And she said, you know, I know you're doing well in this city, but she says, no one will miss you when you leave. And I thought, oh, that's really shocking. But she says, you can make a difference here. And so I came.
The value here is kind of unmeasurable. We are the only, you know, place in town.
And I think what's been key to our community, and we're going to try to keep it, is there's healthcare here. And you know, we connect. You know, if I can't do anything for you, we have a very good ambulance service. You know, we'll fly you out of here if necessary. I'll talk to a specialist. We can get a lot of stuff done. And so it's an attraction to a community that we want to keep.
Karen's passion is just to really be able to take care of people in the county and the surrounding areas. She just really is passionate about that, and we try to do our very best to provide a really good quality of care for the community.
We have been lucky to have a rural health clinic. A lot of small towns don't, and we are starting to see some influx of people moving here, and the biggest population are the retired.
What's the plan for when Karen retires?
I don't know. Everybody asks her that, and the patients are real concerned. Gosh, Karen, do you know when you're retiring? What are we going to do? Hopefully, the clinic will, continue. We have several kind of homegrown individuals that are currently in nurse practitioner school, and we have quite a few of them. I think maybe 4 or 5 in the area. So we're hopeful that once they get their degrees, that they will be wanting to stay in Crowley County and practice in Crowley County. So
there's some hope about a pipeline to get some help, but that's a couple years away. Yeah, so the word is, I can't hide it, I'm 65. Am I retiring? I'm not retiring. But I'd like to cut back. And I would like to sell my practice, because owning a rural health clinic it's really hard financially. We really can't afford to. I hope someone would come in, because I can't close the doors. There'd be all these folks, and it's just kind of like, and for an economic development thing, there's nothing like having health care in a small community.
So let's pretend, we're back, what is it, 30, 40 years ago,
Yeah.
when you get the letter from Dr. Bird.
Yeah.
What would you tell yourself then? Or what do you wish you had known then? Or
I'd do it again. I would do it again.